Good afternoon, everyone. Welcome to DRH Live. I'm Cindy Crook, and I'm the Director of Marketing at Duncan Regional Hospital. And today we are going to talk about nursing education opportunities that are available right here on our campus. And I have with me Cindy Rao, and she is the Chair of Rural Education for the Kramer School of Nursing, which is with OCU. And we have Linnell Taylor, and she is the Director of Education right here at Duncan Regional Hospital. So welcome, ladies.
Thank you.
First, I want to start with Cindy. Cindy used to be our Chief Nursing Officer. I think you started with OCU last fall?
Yes.
Okay. So I wanted her to share with everyone why we have a learning center in the first place on our campus. Not many hospitals do that. It's very progressive of us, and Cindy was very instrumental in getting this established. So I thought we'd do a little history and let her tell.
Thank you. It really was about supply and demand of nurses for Southwest Oklahoma, and we did not have enough nurses, RNs, to supply the hospitals, to ensure adequate staffing, to even think about expanding services and to be able to provide the services that we have. So we were very fortunate to have a very supportive and visionary Duncan Regional Hospital Board of Directors, and also the DRH Foundation was instrumental in helping to build this learning center. And we have a simulation lab also that is a part of this. And since then, we have not, since this has begun, Duncan Regional Hospital has not had to use contract labor, which is so important. Having enough nurses ties into the quality of nurses and nursing care that we provide. We also have the Institute of Medicine is in 2008 put out a statement on recommendations for nursing, and one of the statements was to have 80% by 2020 of bachelor's prepared nurses at the bedside. And there are so many studies out there that talk about the increased quality, patient safety, if you can meet that goal. So was also part of the plan when we built this, was to focus on increasing BSN nurses here.
And what year did this open?
2008.
2008.
Yes, and we also, when we started talking about this dream and about this vision, we worked with Cameron University, and they very much are a partner with us. They offer that the Oklahoma City University Kramer School of Nursing, we deliver the last 2 years. So you enter as a junior, and so you complete all of your classes here at the Learning Center in Duncan, your junior and senior year. The first 2 years, you can get all of that at Duncan Cameron location, and you would graduate with your allied healthcare associate's degree. So that was certainly part of this partnership with us, and you can get your prerequisites in your 2 years anywhere, but it's certainly a very good thing to be able to get everything right here in Duncan locally. Part of our thought and vision and goal was to grow our own for Southwest Oklahoma, grow our own nurses.
That's great. Well, Linnell, why don't you tell us about the programs that are currently here?
Well, currently here at Duncan Regional Hospital Learning Center, we have Oklahoma City University Kramer School of Nursing. They have their traditional program that's here. We also have the OU Accelerated Bachelor's Program, and that's out of the Lawton campus, but they attend their didactics classes here at our Learning Center.
Okay, I'm not clinical, and some people may not be clinical. What does didactic mean?
Their classroom.
Okay.
So the classroom, they come here to our Learning Center and have the classroom part of their education here at our Learning Center.
And so tell them, I go over to the hospital and I see lots of them in different college scrubs. So what are they doing over there?
We have lots of schools that do their clinical rotation at Duncan Regional Hospital. And so they are doing their clinical hands-on practice after they've learned in the classroom and the labs, and they are competent to come to the hospital and learn on a real person. So they're doing clinicals. So clinicals means that they're doing their real life practice in a hospital setting. So we have lots of different students that rotate through our hospital in a clinical setting.
I'm kind of putting you on the spot, and you may not know, but since the center's open, how many nurses do you think we've graduated? I know, I mean, on the average, there's what? Maybe,
I mean, I just a guess would be 50 to, I mean, probably, that's just a guess. Probably
Yeah,
even more
yeah.
than that. That we've graduated.
That you've graduated,
Oh,
a lot
it's
more than
hundreds.
that.
Yeah, it's in the
hundreds.
hundreds. It's in the
yeah.
hundreds.
okay.
Because basically the classroom is about 20 to 25 students
Yes.
for each class since 2008. So I'm not very good at math in my head. So, but there's a lot of team members that we have employed at Duncan Regional because of this learning center.
One of the other things I want to talk about, and I think is very important, is our simulation lab. And I touched on that, but the Board of Nursing just recently has granted hours that can be used for high fidelity simulation labs. And I will tell you, in this past year, the DRH Foundation has raised money to buy us state-of-the-art mannequins, and that has been from donors. And so that is so critical, because now we can use, we truly have the state-of-the-art simulation lab here in the Learning Center, and our students do not have to travel for that experience and can obtain that experience here. And they also can count some of those hours now as classroom hours that the Board of Nursing just recently approved. So that is really great for this center.
So explain those. So now you say simulation. So explain what these simulators, what does that mean? What can they do?
Well, these simulators are very high tech. They can talk, they can bleed, they can have all kinds of body fluids. We can actually make them die. So everything in a controlled setting, so that the students actually get to learn hands-on in a controlled setting where there is no harm done, but learning.
Both of you have been nurses for a while and stuff like that, so I'm just kind of curious about it. How have you seen how nursing education has changed since you went through to get your BSNs and stuff like that?
In some ways, it has come full circle back to a lot of the hospital education, and the hospitals becoming more involved and supportive in education. But it certainly has, like I said, the simulation experience is new. They are changing the NCLEX. That is the test that nurses, when you graduate from nursing school, that you have to pass. They're getting ready to change that, the questions on that in the near future. And so it really is all based on more critical thinking, which is what I know as my role as Chief Nursing Officer, that is one of the things that nursing leadership wants to see. They want to see nurses coming out that have that critical thinking skills. And that certainly is being taught more.
Absolutely. Because the research has shown that novice nurses, new graduates, don't have the critical thinking or the clinical judgment that is needed to be a bedside nurse. So Kramer School of Nursing is implementing in their first fall classes a critical thinking course. And so that's going to be very instrumental in doing a pilot study to see on that next generation NCLEX that will be coming out in 2021, how we are going to improve that critical thinking skill for that new graduate. It's going to be very interesting.
Okay, so I'm in high school, and I think I want to become a nurse. What should I be taking in high school and in college? What classes? Where should I be concentrating?
Science classes are really important. I would strongly encourage to take science classes, to take math classes, and that you can take classes in high school at college level. And there's counselors at Cameron University that are very, very familiar with this and know what classes to guide students and to help guide them to make sure they're taking the classes that'll benefit them.
At the high school level, I encourage them to get involved in their health careers
Yes.
classes. Get involved in your health career bonus clubs, and so that you can decide if healthcare is really where you want to be. There's all kinds of things at the tech centers
Yes.
for phlebotomy and CNA, certified nursing assistant. So there's different areas that you can see if you want to be a nurse before you actually get accepted into a program. Medical terminology is another really good one to take if you're in high school.
The programs here at the Learning Center are for BSNs, Bachelor of
Correct.
Science.
Correct.
So if I'm an LPN or I have an associate's RN, how do I get into the bachelor's program?
We have through Oklahoma City University. There is a associate degree, AD, associate degree to BSN program, and so that certainly would be an option. And it's also an option for the LPNs to go to get their BSN through this program here.
Okay.
That's certainly an option.
Okay. And I'm assuming OU probably has the same.
Yes,
type program.
absolutely. There's a lot of RN to BSN programs out there. A lot of them are online. Some of them are classroom, brick and mortar type classes, if that's the way you learn. But there's many programs out there. OU does offer one,
So if they want to apply to either program, they need to just contact the schools themselves,
Yes.
not
Yes.
here, but we do have a recruiter at the hospital. But to apply, they need to go to the schools. Is that correct?
And
correct.
we actually have someone here in the Learning Center here on DRH's campus for Oklahoma City University that's here that would be able to advise somebody and talk to them.
And then OU's is theirs in
Lawton. Yes.
Okay. So let's talk a little bit about this new thing that's kicking off. It's through OCU right now, about the tuition and what Duncan Regional Hospital is offering. So
Yes.
I'll let you explain that.
Well, one thing I want to talk about is the nationwide nursing shortage. We are in a critical nursing shortage, and they have projected this shortage, and they project it to last for many, many more years because of the baby boomers and the increased need for taking care of the aging population. So one of the unique things with the relationship and the partnership with Oklahoma City University, with Duncan Regional Hospital, and just recently Comanche County Memorial Hospital, is they are focused on recruiting nurses that meet the qualifications, the GPA for the school, that want to live and work here in Southwest Oklahoma. So if you have someone that is interested in being a nurse, and we certainly are working on starting in the high schools to get this message out for those that are interested, and at all levels. I mean, there's people that have had careers and have, for whatever reason, decided they wanted to be a nurse. Maybe they've always wanted to be a nurse, but this certainly is an opportunity. So if they meet the criteria for Oklahoma City University, then the hospitals would be interviewing the person, and if they are somebody that is a good fit for the hospital, they certainly would want to choose someone that wants to stay in this area and work in this area, and they would be chosen for a special scholarship, again, that Duncan Regional Hospital and Comanche County Memorial Hospital, and it's a limited number, like 20 for each hospital. They would pay full tuition and full fees. So you would be able to go your last junior and senior year to a private university and get all of your schooling paid for. And with that commitment, there is a work commitment of 3 years at the hospitals, which is a great thing too.
And so we can we'll ask them about going to CHAD to get more information
Yes.
on that. A little bit lighter notes. Do you see more men coming into nursing?
I do. I do. We see at least 1 to 2, sometimes even up to 5 men in each class just in the last 5 years. So we need men in nursing also. There's a place for anyone.
And nursing is a profession that you can work anywhere. There are so many different things that you can do. I've been a nurse for over 30 years and I've absolutely loved everything I have done. But it's a profession that you're going to be able to find a job and meaningful work. And we really call it more, you want the right people to go into nursing because they have a heart for nursing. So, we've always called it's not really a job, it's a profession.
It is, absolutely.
It's a calling.
There's a nurse tech program here
There
at
is.
the hospital. Could you tell us about that?
The Nurse Tech program here at Duncan Regional Hospital is after you have completed your first year of a nursing program, you can apply for our Nurse Tech program, summer program. It's an 8-week program where you rotate through every department of our hospital and you get to do the skills that you've learned in that first year of a nursing program. So you get to start IVs, put in NG tubes, do wound care. Only thing you cannot do, according to the Board of Nursing, is to give medications. So it's an 8-week program and you get paid for it and you get to really hone in on your skills. So that will start in June. So it's June and July. We've already selected our 23 nurse techs, and so they will be starting our general orientation the first week of June. Really excited about that program.
And do you have a mentoring program?
We do. Also at Duncan Regional Hospital, when this learning center was built in 2008 and in 2009, we implemented a leadership and evidence-based program. And so that's our LEAP. And so that's for any RN graduate that is under 2 years of nursing experience, comes into our facility as a new hire and goes into that 8-month program. So it's a mentoring program. It's also getting to have a way to have partners. Everyone's in the same boat. They have less experience than the experienced nurse. So it's a bonding and it's a support, and it's been very instrumental in our turnover rate. We had a very high turnover rate before this program was implemented. And 2 years ago, I'm not sure exactly what this year was, but 2 years ago we were at 0.04% turnover in our first year. So
what's the dealing with the students that have gone through either program here? Have you received any feedback about the ratio or the amount of time that they get to spend with instructors? And do they like it because it seems it's the instructors closer here? I mean, just any kind of feedback on that.
Well, because both of our schools that come to our Duncan Regional Learning Center are smaller classrooms. So there's 18 in the Accelerated Bachelor's Program through OU, and for OCU and Kramer School of Nursing, we had 12. So it's smaller class sizes, so you get that one-on-one more attention. And it's great. It's great that you can do all of your clinicals here at Duncan Regional, so you get to know the people that you're going to be working with when you graduate.
And how the classes are delivered is through Polycom. So there is always an instructor here at with the students, and the instruction is either being given by the instructor here at Duncan on the Learning Center or in Oklahoma City. So that's how it's delivered, because people may not understand that. But there's been a lot of money invested in the Polycom technology, and it truly is like you're in the classroom with them. The technology is really, really good.
Well, we're going to wind up because we've given a lot of information, but I think it would be great if both of you, in your own words, just say what you think, how you feel to be a nurse and why someone should become a nurse, and about the profession, or just some words of wisdom to anyone out there that may be contemplating, is nursing for them? Anything that you can share. Both of you have many years of experience doing that, and I think you guys do.
One thing I want to say, like I said, I've never regretted being a nurse. It's a great profession. Nursing school is not easy. You need to have the support of your family. It requires a lot of studying, a lot of time. One thing I will say that has been a joy to us, that the stories that we have heard from people that have went through this program, that maybe they would not have had that opportunity if it wasn't right here in Duncan, because of family, because that just would not have children, that would not have been an opportunity for them. And so that has been a really positive thing to be able to see that here in Duncan.
Well, I was a stay-at-home mom for 11 years, so I didn't start college till I was 27. So, and then I had to drive 60 miles, one way to school. So the Duncan Regional Learning Center is a blessing to this community, to surrounding communities, that you can become a nurse. If that's what you want to do, you can become a nurse right here in your backyard.
That's great. Well, ladies, thank you. Really appreciate you taking the time to do this. We're going to hold up a phone number here. If you are interested in any kind of information about our programs here, Chad Jackson is our nurse recruiter. He would love to talk to you, or you can come down to the Learning Center, and some of these ladies will be here and you can talk to them. So thank you for joining us with DRH Live, and we will see you next month.